अरे तुझे पता है थर्ड वेव आने वाली है? तुझे पता है अक्टूबर नवंबर में कोविड की थर्ड वेव आ रही है? बीमार पड़ने के लिए तैयार हो जाना। पैसे खूब जमा करके रखना, बहुत पैसे जाने वाले हैं। Don't fall into any of these rumors. Hello guys, this is Dr. Jai and I am a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more. This is a place where we'll be talking everything about good health and everything good about health. So today in this video we'll be discussing every question and every doubt related to COVID-19 third wave. So the first question that comes to every one of us is, when will the third wave arrive? Now, no one can say with the exact date whether the third wave will arrive or not. If it is going to arrive, then when it will arrive. Now, according to my experience of these epidemics and pandemics, these are the viruses that are related to respiratory viruses, and these viruses have a constantly mutating forms. So this is the adaptation of these viruses for survival. That is, nature is helping them to survive. But don't be worried, nature is helping us also to survive. So how are we going to survive, and how are these viruses going to survive? The only possible explanation for this is we have to learn to coexist. Yes. And let me tell you, this is not a new thing. We have already coexisted with lots of such respiratory, such hazardous viruses. But how? You must have heard about the influenza viruses, right? The influenza viruses that has caused epidemics of swine flu, that has caused epidemics of bird flu. We have learned to coexist with them. The same way, we will be learning to coexist with the COVID viruses. But how? These are the similar viruses to influenza viruses in terms of changing forms, in terms of frequent mutations known as antigenic shift or antigenic drifts. So, as we have seen, the first wave that arrived was the original COVID virus. The second wave was relatively mutant, or we can also say that it was a double mutant virus. The third is Delta variant. Delta variant is a mutation of original COVID virus so that it can survive against human immune system. A logical thing is, as soon as these new viruses take infections to the other humans, that infection will keep on spreading, and that will create a third wave. That is a typical mathematical calculation, but that doesn't always apply to epidemics and pandemics. So how and when the third wave will be arriving cannot be said for sure. But yes, what do we have in our hands is to protect ourselves from these dangerous viruses by keeping ourselves safe with the help of masks, social distancing and vaccination. The second question that comes to our minds is, if at all the third wave is going to come, then what is our preparedness? Are we really prepared for the third wave, or are we still going to suffer the way we have suffered in the first and the second wave? Yes, we can say that we have learned a lot from the second wave and the first wave. We have tightened up our belts and we have upgraded our health systems. We have also upgraded our medical therapeutics. But if a huge bulk of people get sick, the way they have been sick in the second wave, it will always be difficult to handle such a big number of patients in wards and ICUs. We should always be careful, we should always be cautious not to develop a wave that is in that magnitude as that of the second wave. Because if that comes again, we will be losing a lot of lives. The third question that comes to our minds is, if at all the third wave is coming, what sort of preparations are needed for tackling third wave? Now this is a bit tricky question. Why? Because we have learned from the second wave that the requirements to tackle this pandemic was drugs, oxygen, continuous healthcare and active healthcare, and a dedicated medical staff, dedicated medical professionals. So we have to upgrade ourselves in every department regarding health, whether it is remdesivir, whether it is oxygen supply, whether it is tocilizumab, or whether it is in form of regular working hours of doctors and nurses, because we have suffered in that department also. You must have heard about the deficits that we have faced regarding remdesivir, tocilizumab and oxygen. But that was just part of the entire breakdown of the healthcare system. The other part was shortage of the medical supplies along with shortage of the medical professionals. Within this short period of time, we cannot arrange the medical professionals because doctors and nurses takes a lot of time to get trained. So we have to solely rely upon human resources that we already have to tackle the condition. What we have is only and only upgradation of the healthcare system in form of the available drugs and oxygen. Oxygen will be the most deciding factor in preventing deaths this time. Now the fourth frequent question that comes to our minds is, will the vaccine be helpful? Yes, you can always say that the vaccine will be helpful. The reason is, as we have previously discussed, these are the viruses that constantly keeps changing their form. So they are always likely to recurrently infect humans. And with that logic, vaccine can always give you a constant supply of antibodies and protect you from these viruses. But that doesn't mean you will not be infected with the COVID virus or the Delta Plus variant in the upcoming wave. So one cannot say that if he or she has taken 2 doses of vaccine, they will be protected from the COVID infection. No, they are always likely to get the COVID-19 infection, but the only advantage that they will be having is they will be protected from the serious consequences of COVID-19. Now these serious consequences are severe pneumonia, oxygen requirement, breathlessness. Now these difficulties can be handled easily once you are vaccinated. The reason is you will be having a baseline level of antibodies that will keep you protected against these incoming Delta variants of COVID-19. The next question that is frequently asked is whether the already infected patients will be reinfected in the upcoming wave. The answer is yes. The reason is the changed form of virus, that is, the Delta Plus variant that we will be seeing now is different from virus that was circulating in the very first wave. So your body will be recognizing Delta Plus variant of COVID-19 as different from that it acquired during the second wave or first wave. But if you are vaccinated, you will always be protected from the serious consequences because you will be having antibodies that will easily counter the Delta Plus variants. The last and the most important question: how will we be able to reduce mortality or death rates? Because after all, what is most important is to protect lives, to protect humans. We have to make efforts in every segments of healthcare, starting from doctors, nurses, healthcare professionals, drugs, ambulances, hospitals, ICUs, hospital beds, oxygen supply, remdesivir, tocilizumab, everything. Because all these factors have played a very vital role in increasing the death rates that we have seen in the second wave. So, if we are lacking in any of these departments, we will be losing lives the same way we have lost in the second wave. But here the most important factor that will be deciding the fortune of the third wave is oxygen. Yes, because oxygen is such a thing that even a deficit of oxygen for 10 minutes, for 15 minutes can kill a person. Tocilizumab, remdesivir or any other medicines that are required for treating COVID can be arranged in a day or two, in a week or so. But deficiency of oxygen will always be left. So we have to upgrade ourselves at least, if not all, at least in the department of oxygen. Because oxygen जैसे नाम है, हिंदी में कहते हैं प्राणवायु, तो नाम से ही पता चलता है कि it is important. And if we are lacking in that, we'll always be losing it. The only message of this video is don't panic, don't spread rumors. The reason is fear is the biggest pandemic. COVID तो handle हो जाएगा, डर नहीं हो. So keep yourselves away from rumors and don't spread rumors. So guys, this was all for today. This is Dr. Jay signing off for today from Dr. Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to my channel, do like the video, do share the video to everyone you feel this video might help, and do share your doubts and questions regarding health in the comment section. I'll be more than happy to help. See you till the next time. Bye.
3, 2, 1.